Good day everyone, my name is Jeff Daniel C. Florida, your student nurse for today, and today I am going to be demonstrating about the assessment of the eyes. Pre-introductory phase. Review the client's previous medical records if available. This is done for you to know the previous medical history of the patient to provide focus on the physical assessment of the patient. Hello ma'am, good morning. Hello ma'am, good day. I am your student nurse for today. May I know your name ma'am?
I'm Sophia.
Okay ma'am Sophia, when is your birthday?
September 16, 2006.
Okay, so later ma'am Sophia, we will be checking and assessing your eyes. So, how are you feeling today ma'am?
I'm fine, nurse.
So, ma'am, the procedure that we are going to do is about the assessment of the eyes. This is to check and know if you have problems in your eyes in different angles or situations. So, ma'am, do you have any concerns about the procedure?
None.
Okay, ma'am. Ma'am, before we start, is it okay for you that the door will be closed so that no one can see you?
Yes.
Ma'am Sophia, are you comfortable with your position? Okay, ma'am. So, Ma'am Sophia, in this health assessment of the eye, all the informations that we are getting from you will be kept confidential. Meaning, the informations cannot be shared through the public, but only can be shared, but can only be shared, One, two, three. So, Ma'am Sophia, in this health assessment of the eye, all the informations that we are going to get from you will be kept confidential. Meaning, all the informations cannot be shared through the public, but can only be shared through the doctors, the nurses, and the ones that who will help and assess you.
Okay.
So, Ma'am Sophia, do you use any visual aids like contact lenses or eyeglasses?
No.
No. So, rationally, check for any use of visual aids prior to starting the test. This includes contact lenses or eyeglasses. And if your client has visual aids, make sure to let them wear it before proceeding to the procedure. Have the client stand 20 feet or 6 meters from the Snellen's chart. Then cover the eyes that needs to be tested. Then ask the client to read each letter, and you will have just to wait for the client to read each letter.
P-O-Z L-P-E-D E-D-F-C E-F-P-T.
Then record the readings of the left and the right eye and the both of the eyes. Perform selected vision, light perceptions, hand movement, counting fingers if necessary. And if the patient is unable to read the 20/100 or the letter E of the Snellen's chart. Ma'am, can you tell me where the light is?
Up. Right. Left. Down.
Testing for visual fields. Face the client directly at a distance of 60 to 90 centimeters or 2 to 3 feet. Instruct the patient to look directly at the examiner's eyes with both eyes. Place hands about 2 feet apart, lateral to the patient's ear. Move wiggling fingers of both hands along with the imaginary ball and over the patient's head until he or she identifies the object and asks the patient where the object is first spotted and repeat the procedure on the upper and lower quadrant. And tell me if you can see my wriggling fingers.
Yes. Yes. Yes.
If a defect is detected, move the wriggling fingers from the defected area of the field towards the better vision and repeat this at several levels until the border of the defect is identified. Test the another eye for accompanying if there is a defect. Visual inspection of the eye. Visually inspect the eye for alignment and symmetry. Inspect the eyebrow. Inspect the eyebrows for hair distribution, alignment, skin quality, and movement. And ask the client to raise or lower his or her eyebrow. Inspect the eyelashes for evenness of distribution of curl. Inspect the eyelids for surface characteristic, skin quality, and the texture. Inspect the lower eyelids while the client's eyes are closed. Inspect over the lacrimal gland and the lacrimal sac for swelling. Ask the patient to look up and depress the lower lid of the client with your tongue. And afterwards, assess the sclera and the bulbar conjunctiva. Invert the eyelids to assess the palpebral conjunctiva. Inspect carefully in each iris and pupils. Inspect cornea and lenses for opacity, clarity, and texture by using a pen light from the side towards the eye. And ask the client to look straight ahead while doing so. Mali. 1, 2, 3. Assess direct and consensual papillary reaction to light. Darken the room partially and ask the client to look at in a distance. Shine a light obliquely into each pupil in turn by using a pen light approaching from the side. Look for direct and consensual reaction. Okay. Assessing the accommodation. Hold an object or a pen light or a pencil about 10 centimeters or 6 inches from the patient's nose. Ask the client to look first at the top of the object and then look at the distance of the object behind the pen light. Instruct the patient to alternate gaze from near to far object and observe for pupil reaction. Ask the client to look at the near object and then Move the object towards the patient's nose. Okay. Salamat. Performing Hirschberg's test. From about 2 feet in front of the patient, shine a light into the patient's eyes and ask the patient to look at it. Inspect the reflection in the corneas. Look for direct and consensual reaction. Performing the cardinal field of gaze text or testing the extraocular muscles. Stand 2 to 3 feet in front of the patient. Ask the patient to follow the examiner's fingers or pencil while making a wide movement in the air. Look for jerky movements of nystagmus on lateral gaze and upward gaze. Watch for rim of sclera between the upper lids and iris as the eyes moves up and down. Ask the patient to look at the examiner's fingers as the examiner moves it towards the bridge of the nose and check for convergence. Summary and closing phase. Summarize the information obtained from the working phase and discuss it with the client. Discuss with the client possible plans to resolve health concerns if present. Assess the client's understanding of the plan and the need for further teaching. Provide the client's opportunity to clarify, ask or raise for any concerns. Thank the client and end the interview politely. Ma'am, that is all for our eye assessment, and thank you for coming in our hospital. And that's a good thing that you are making an appointment of a checkup for your eyes. So my findings in your eyes are all normal and there is no problem. In your lacrimal sac, it is normal. Your iris and pupil are at the same size and shape and all normal. Your eyebrows are normal, the texture and the size. The eyelids are normal. The sclera is on the right color and normal. And your bulbar conjunctiva is also normal. And any other reactions also on the assessment of your eyes are all normal.
Thank you, nurse.
Thank you.
Good day.